Ladies and gentlemen, we shall now begin our program. A pleasant morning to our distinguished guests, representatives from partner agencies, members of the academe, fellow public servants, and everyone present here today. Welcome to the 2025 National Demographic and Health Survey Regional Dissemination Forum. This activity aims to present and discuss the key findings of the 2025 NDHS and its implications to policy and program development in the region. We are also live through the official Facebook page of PSA Negros Island Region and PSA NIR YouTube channel using the hashtag NIR 2025 NDHS to ensure wider public access to the presentation and discussions. To start our program, may we all rise for the opening prayer to be led by Ms. Maria Ella Bagaforo, and please remain standing for the singing of the Philippine National Anthem.
Let us put ourselves in the presence of the Lord, in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Lord, we come before you today with grateful hearts, thankful for this opportunity to gather once again. As we begin today's event, we ask for your guidance and blessings upon everyone present here today. Grant us attentive minds, another. May the discussions and information shared today help us become more aware of the realities faced by many people and encourage us to continue doing our work with integrity, compassion, and purpose. Remind us that behind every number and every piece of information are real lives, families, and communities that matter. May the rest of this activity be productive, peaceful, and worthwhile for all.
Mga kababayan, ang pambansang awit ng Pilipinas.
Please take your seats. Good morning, Services Office, Negros Island Region. Welcome to the 2025 National Demographic and Health Survey Regional Dissemination Forum. To formally welcome us all, may we call on the Officer in Charge, Regional Director of PSA Negros Island Region, RD John F. Campomanes. Let's give him a big round of applause.
A pleasant morning to all our distinguished guests. We acknowledge our partner agencies and invited speakers, the Philippine National Police, represented by Police Captain Wilma Incomieda Silva, ma'am. The Commission on Population and Development, represented by Assistant Regional Director Jonathan Juteles, sir. And the Department of Health, represented by Ms. Rosel Luis Publico Bandal, Cluster Head of the Public Health Research and Intelligence. We also recognize our local government units, members of the academe, healthcare workers, representatives from the media, my PSA colleagues, and all stakeholders joining us today for the National Demographic and Health Survey Forum. As the Negros Island region continues to strengthen its identity as a newly established region, the importance of reliable and responsive statistics become even more vital. Today marks a meaningful milestone for the Negros Island region as we hold this NDHS forum. We hope to provide everyone with valuable insights into the health and demographic situation of Filipino families, from maternal and childbirth, nutrition, and family planning to healthcare access and overall well-being. These statistics serves as an essential guide in understanding the realities faced by our communities across Negros Occidental, Negros Oriental, Siquijor, and the highly urbanized city of Bacolod. Behind every number is a story. A mother seeking accessible health care, a child needing proper nutrition, a family striving for better living conditions, and communities hoping for responsive and inclusive public services. Through the NDHS, we are reminded that statistics are not merely figures in a report, but powerful tools that base programs that genuinely respond to the needs. It is an opportunity to strengthen collaboration among agencies, planners, researchers, and policymakers in translating data into concrete actions and meaningful interventions for our communities, especially our families, women, and children. We, the Philippine Statistics Authority, remain steadfast in commitment to providing quality statistics that support informed decision-making and sustainable development. As we move forward together as one region, may the findings of the NDHS continue to guide us in building healthier, more empowered, and more resilient communities throughout the Negros Island region. Mabuhay ang Negrosanon and Siquijodnon. Danggang salamat sa atong tanan and mayong aga sa Dios.
Thank you very much, R.D. John, for your warm and inspiring message. At this moment, let us hear the message of the Undersecretary, National Statistician, and the Civil Registrar General, Undersecretary Claire Dennis S. Mapa, through an audiovisual presentation.
To our distinguished guests, representatives of our distinguished guests, representatives of partner members of the development party, members of the academic community, and my colleagues, lesson day to all authority. Today, lesson day we convene the 20th Regional National Demographic and Health Survey. National Demographic and Health Survey Authority will present the Philippine Statistics Authority will present these guide our policymakers that would help in drafting programs that respond to the needs of our people. This forum allows us to collectively reflect on how this data can facilitate evidence-based policymaking, strengthen regional and local program planning, and enhance the monitoring and evaluation of population and health initiatives. The 2025 National Demographic and Health Survey is the 13th in a series of surveys conducted since 1968, designed to assess the country's demographic and health situation. Notably, it is the first survey conducted following the institutionalization of the conduct of the National Demographic and Health Survey every 3 years, beginning in 2025. This strategic shift ensures that data generation aligns more closely with the midterm update of the Philippine Development Plan, thereby enabling more responsive and timely policy and program adjustments at both the national and regional levels. The data from the National Demographic and Health Survey will be monitored over time to evaluate the effectiveness of health-related interventions in improving outcomes for Filipino families. More importantly, at the regional level, this data will serve as a critical foundation for identifying gaps, setting targets, and prioritizing interventions that address the needs and realities of communities across regions. The National Demographic and Health Survey serves as a vital instrument for monitoring our country's progress towards achieving the Sustainable Development Goals or SDGs. Through this regional fora, we can examine not only national trends, but also regional patterns that highlight disparities, gains, and areas requiring urgent attention. Some of the key indicators we will highlight today are the following: adolescent fertility, family planning, maternal care, childhood mortality, and child immunization. Measures that track our progress toward SDG number 3, good health and well-being. Second, violence against women and women's empowerment. These are critical indicators that underscore our commitment to SDG number 5, gender equality. And finally, child discipline, an essential measure that speaks to our pursuit of SDG number 16, peace, justice, and strong institutions. We want the National Demographic and Health Survey to continue providing reliable and timely information that regional planners, local chief executives, program managers, policymakers, and social scientists, researchers that they can depend on. With the National Demographic and Health Survey, we better understand demographic and health trends. We see where we have been, where we are now, and where we need to go. Using the NDHS data, we are better equipped to design targeted interventions, refine policies, and ultimately improve the well-being of our constituents across all regions. The results of the 2025 National Demographic and Health Survey will also allow comparison with the 2022 NDHS, which captured demographic and health indicators during the COVID-19 pandemic. In contrast, the 2025 National Demographic and Health Survey provides a clearer picture of the post-pandemic situation, approximately 5 years after its onset, enabling us to assess whether key indicators have improved or declined and how recovery efforts have translated into on-the-ground outcomes across different regions. We thank our partners who made the National Demographic and Health Survey possible: national government agencies with technical assistance provided by the United Nations Population Fund Philippines through Australia's Department of Foreign Affairs and Trade, Social Protection, Inclusion, and Gender Equality, or the SPRING program. Funding from the government of the Philippines, and the invaluable contributions of the Commission on Population and Development, the Department of Health, United Nations Children's Fund, Philippine Commission on Women, and the University of the Philippines Population Institute during the preparatory and training phases of the survey for stronger collaboration and more responsive data-driven policies across regions. We invited experts and partners to share their insights on turning these findings into actionable strategies and responsive interventions within their respective areas. At this point, we will unveil the regional data and key indicators generated from the 2025 National Demographic and Health Survey. Maraming salamat at magandang umaga sa ating lahat.
Thank you very much, USEC MAPA, for your meaningful message and continued support to statistical development. At this juncture, ladies and gentlemen, to give us better understanding of the survey, let us now watch another audiovisual presentation on the background and overview of the 2025 NDHS. May we kindly request everyone to direct their attention to the screen.
and health surveys since 1968, and the first to be implemented as a midterm round by the Philippine Statistics Authority, with technical assistance provided by the United Nations Population Fund Philippines through the Australian Department of Foreign Affairs and Trade. The 2025 NDHS is the first round ever to be implemented by the PSA as a midterm survey pursuant to PSA Board of Resolution Number 10, Series of 2024, approving the conduct of the survey every 3 years starting in 2025 to align with the midterm updating of the Philippine Development Plan. The survey results also serve as inputs for the monitoring of the Sustainable Development Goals. The funding for the 2025 NDHS was provided by the Government of the Philippines. The UNFPA Philippines provided technical assistance through the Australian DFAT Social Protection, Inclusion and Gender Equality or SPRING program. The primary objective of the 2025 NDHS is to provide up-to-date estimates of basic demographic and health indicators. Specifically, the 2025 NDHS collected information on fertility, fertility preferences, family planning practices, childhood mortality, maternal care, child health and development, violence against women, and other health issues. The information collected through the 2025 NDHS is intended to assist policymakers and program managers in designing and evaluating programs and strategies for improving the health and development of Filipinos, attainment of the SDGs and the PDP for 2023 to 2028. The 2023 Geo-enabled master sample was used to generate sample households for the 2025 NDHS. The 2023 GOMS uses the results of the 2020 Census of Population and Housing. The enumeration area reference file of the 2020 CPH is used as reference in constructing the primary sampling unit frame, while the 2020 list of housing units for each of the PSUs is used as the secondary sampling unit frame. The 2025 NDHS implemented a two-stage stratified sampling design to select households to be part of the survey. The first stage of the sampling procedure is the selection of 1,263 enumeration areas or barangays as the primary sampling units or PSUs distributed by province and the highly urbanized cities or HUCs nationwide. Meanwhile, the second stage is an equal take of 24 and 32 sample housing units for province and HUC domains respectively was selected from each sampled PSU using a systematic random sampling. This sampling scheme provides data representative of the country as a whole for urban and rural areas and for each of the country's 18 regions. Sample households were visited for face-to-face interviews, and information about the household was obtained using the household questionnaire that was loaded in the tablets. All women aged 15 to 49 who were either permanent residents or visitors was interviewed using the individual woman's questionnaire, which are also loaded in the tablets. Among women eligible for an individual interview, one woman per household was selected for the Women's Safety Module. One child aged 1 to 14 years was selected in a household for the Child Discipline Module, and one child aged 2 to 4 years per eligible woman was selected for the Early Child Development Index Module. A total of 41,602 housing units or households were selected for this sample, of which 36,309 were found eligible for household interview. Of the eligible households, 36,120 in the interviewed households, 30,223 women aged 15 to 49 years were identified for the individual interviews. Interviews were completed for the 29,694 women, yielding a response rate of 98.2%. The 2025 NDHS has two main questionnaires and a field worker questionnaire. The sample households that were systematically selected for the survey were visited and enumerated using a household questionnaire. The household questionnaire permits the interviewer to identify women who are eligible to be interviewed using the individual woman's questionnaire. The questionnaires were finalized in English and translated into 6 major languages including Tagalog, Cebuano, Ilocano, Bicol, Hiligaynon, Waray. The household questionnaire collected data on usual household members and visitors. housing characteristics, health insurance coverage, health facility utilization, knowledge of local health programs, child discipline. Meanwhile, individual women's questionnaire collected data on respondents' background, reproduction, family planning, pregnancy and postnatal care, child immunization, early childhood development index module, marriage and sexual activity, fertility preferences, husband's background and women's work, HIV/AIDS, other health issues, women's safety module. A field worker questionnaire that records the field interviewers and team supervisors' background characteristics was also included. Information gathered from the question. The 2025 NDHS has four survey manuals: Field Interviewers Manual, Supervisors Manual, Computer Assisted Personal Interviewing or CAPI System Manual, Data Processing System Manual. The Field Interviewers Manual was prepared primarily for the use of the field interviewers, team supervisors, and other personnel who are involved in the 2025 NHS. The topics covered in this manual include the objectives, concepts and definition used in the survey, roles of the SRs, and detailed instructions on accomplishing the 2025 NDHS questionnaires. The Supervisor's Manual was prepared primarily for the use of team supervisors involved in the 2025 NDHS. The topics covered in this manual include the background of NDHS, preparation, organization, and supervision during field work, monitoring field interviewers' performance, and managing workload assignments. The Computer Assisted Personal Interviewing or CAPI System Manual provides guidance on operating and troubleshooting the tablet, navigating the CAPI system, conducting household and individual interviews, and managing data collection procedures. The data processing system is used to manage and monitor survey data throughout field operations. It enables users to navigate the system tables to ensure data quality and consistency, and securely upload and mock up collected data. As part of the preparatory activities before the conduct of the data collection, Chao Pangasinan, to test the appropriateness and effectiveness of those that may arise during the actual data collection. A series of training for the field personnel were conducted in two stages. The first level training followed 8 to 19 2025 at the PSA Central Office to train the regional focal persons and the regional IT personnel, led by the Central Office DFAT and Resource Fund Philippines, Philippine Commission on Women, and University of the Philippines Population Institute. The second level training aimed to train the interviewing teams in the respective regions, consisting of the field interviewers and the team supervisors. The SLTs were conducted from September 29 to October 10, 2025, facilitated by the PSA's 18 Regional Statistical Services Offices or RSSOs across the Philippines. After the simultaneous training, the 2025 NDHS data collection was successfully conducted from October 13 to November 29, 2025 by the 114 interviewing teams. Each team consisted of a female team supervisor and 2 to 4 female field interviewers. During data collection, each of the field interviewers were provided with handheld tablets installed with the questionnaires to be used during interviews. The team supervisors also utilized tablets to allocate the workload of the interviewers and to receive and transmit the accomplished questionnaires. The data processing was simultaneously conducted with the data collection from October to December 2025 at the provincial, regional, and central office level. The data processing system produces field check tables intended for monitoring field work and data quality at an almost real-time data collection status. And finally, the results of the key indicators will be unveiled at the National and Regional Dissemination Fora of the 2025 NDHS from March to May 2026.
Thank you very much. We now move on to the most anticipated part of the program, the presentation of the survey results. For the presentation, on child health and development, may we welcome the Statistical Specialist 2 of the Demographic and Health Statistics Division of the Social Sector Statistics Service of the Philippine Statistics Authority, Miss Den Marie Joy Pe. Let's give her a big round of applause.
Good morning, everyone. I will now present the NDHS results. The NDHS data presented for the Negros Island region for the year 2022 are derived from its former administrative regions, which are Western Visayas and Central Visayas, as the NIR was officially established only in 2024 in accordance with the Republic Act number 12000. As such, the figures shown are based on reconstructed estimates and data aggregation from these source regions. An asterisk indicates in the succeeding slides that a figure is based on 25 to 49 unweighted cases. While efforts have been made to ensure accuracy and consistency, these estimates existed as a distinct administrative region in 2022. So users are advised to interpret the data with caution. Now, I will present the child health and development indicators according to the results of the 2025 NDHS. This presentation consists of the following: child immunization, childhood mortality, child discipline, and early childhood development index. If they have received the single dose BCG vaccine, 3 doses of DPT containing vaccine, 3 doses of OPV or IPV. A second measure of vaccination coverage is the percentage of children aged 12 to 23 months and 24 to 35 months who are fully vaccinated according to the national schedule. A child aged 12 to 23 months is considered to be fully vaccinated according to the national schedule if the child has received 1 dose of BCG vaccine, 1 birth dose of Hep B vaccine, 3 doses of DPT containing vaccine, 3 doses of OPB, 2 doses of IP. Meanwhile, children aged 24 to 35 months are considered fully vaccinated according to the national schedule if they have saw an increase from 2022 where 62.8% were fully vaccinated with basic antigens. Meanwhile, 59.8% were fully vaccinated according to the national schedule in the Negros Island region, which also increased from 38.2% in 2022. And then for children aged 24 to 35 months, in 2025, 60.3% were fully vaccinated according to the national schedule in the Negros Island region. This is higher from 45.7% in 2022. Now, let's look at the coverage of specific vaccine under our basic antigens for children aged 12 to 23 months in the Negros Island region. We see that 100% received BCG vaccines, 87.3% received 3 doses of DPT containing vaccine, 89.7% received 3 doses of polio vaccine given as OPV or IPV, and 98.7% received 1 dose of MMR vaccine. In Negros Island region, 8 out of 10 children or 81.3% were fully vaccinated with basic antigens. Among all other regions in the Philippines, NIR ranked 9th highest in terms of coverage of basic antigens among children aged 12 to 23 months. The coverage of basic antigens is highest in the Ilocos region at 95.6%, and lowest in BARM at 22.1%. Next is the national schedule coverage for children aged 12 to 23 months for the NIR. For the additional vaccines under the national schedule, 79.8% received 3 doses of percent, or 6 out of 10 children in the Negros Island region are fully vaccinated according to the national schedule, which is lower compared to the national rate at 62.4%. Among all other regions in the Philippines, NIR ranked 9th highest in terms of national schedule coverage, Ilocos region at 94.3%. In terms of vaccination trends in NIR, the percentage of children aged 12 to 23 months who receive all basic antigens increased to 81.3% in 2025 from 62.8% in 2022. Similarly, the percentage of children aged 12 to 23 months who receive vaccines according to the national schedule also increased to 59.8% in 2025 from 38.2% in 2022. Lastly, the proportion of children who did not receive any vaccination dropped to a less than 0.05% from a 16.3% in 2025. Next on my discussion are the childhood mortality rates. Neonatal mortality rate is the probability of dying within the first month of life. Post-neonatal mortality rate is the probability of dying between the first month of life and the first birthday. Infant mortality rate is the probability of dying between birth and the first birthday. Under 5 mortality rate is the probability of dying between birth and the 5th birthday. For the 10-year period before the survey in the Negros Island region, there was a decline for the mortality rates from 2022 to 2025, where neonatal mortality rate, there were 3 deaths per 8,000 live births, a decrease from 2022 at 11 deaths per 8,000 live births. For infant mortality rate, there were 7 deaths per 8,000 live births, also a decrease from 2022 at 18 deaths per 8,000 live births. And for under 5 mortality rates, there were 14 deaths per 8,000 live births in 2025, which also decreased compared to 2022 at 24 deaths per 8,000 live births. For the 10-year period before the survey in NIR, the under 5 mortality rate is 14 deaths per 1,000 live births. Among all other regions in the Philippines, NIR ranked the 6th lowest in terms of under 5 mortality rate. Cagayan Valley reported the lowest at 7 deaths per 1,000 live births, while Mimaropa reported the highest at 41 deaths per 1,000 live births. Moving on, we have the child discipline, which tracks SDG indicator 16.2.1, or the proportion of children aged 1 to 17 years who experience any physical punishment and or psychological aggression by caregivers in the past month. In NIR, results showed that nonviolent discipline slightly increased to 43.2% in 2025 from 41.3% in 2022. Psychological aggression decreased to 28. Next, any physical punishment showed a decrease to 40.5% in 2025 from 42.8% in 2022. Then for severe physical punishment, there was a decrease to 3.3% in 2025 from 6.6% in 2022. And lastly, any violent discipline method decreased to 49.3% from 57.5% recorded in 2022. Across regions, about 5 out of 10 children aged 1 to 14 years or 49.3%, experience any violent discipline method in NIR. This ranked fourth lowest in terms of percentage, with Davao Region the highest at 70.9% and BARM the lowest at 32.7%. The 2025 NDHS included the Early Childhood Development developed by UNICEF for the Multiple Indicator Cluster Surveys program, which is monitored for the SDG indicator 4.2.1, or the proportion of children aged 24 to 59 months who are developmentally on track in health, learning, and psychological well-being. So in 2025, the percentage of children aged 24 to 59 months who were developmentally on track in health, learning, and psychosocial well-being in NIR increased from 79% in 2022 to 93% in 2025. In NIR, about 9 in 10 children aged 24 to 59 months, or 93.5%, were developmentally on track in health, learning, and psychosocial well-being. Comparing all other regions in the Philippines, NIR ranked the highest in early childhood development, while BARM recorded the lowest at 47.2%. That ends the first presentation. Thank you.
Thank you very much, Ma'am Den, for that informative and insightful presentation on child health and development. Truly, your presentation helped us better understand the importance of nurturing the children's well being and growth. Up next, ladies and gentlemen, for the presentation on maternal care and domestic violence, let us welcome on stage the Statistical Specialist 1 from the Demographic and Health Statistics Division of the Philippine Statistics Authority, Ms. Alicia Marie T. Paredes. Let's give her a big round of applause.
Healthcare services during pregnancy, childbirth, and after delivery are important for the survival and well-being of both the mother and the infant. Gender-based violence is acknowledged worldwide as a violation of basic human rights, and a common form of gender-based violence is intimate partner violence or domestic violence. In this presentation, we will in the 2025 NDHS. For the outline of this presentation, I will first present the results on maternal health and then domestic violence. In the 2025 NDHS, maternal health information was obtained from women aged 15 to 49 years who had given birth in the 2 years before the survey, neonatal tetanus, and postnatal care during the first 2 days after giving birth. In NIR, the antenatal care, tetanus toxoid protection, and postnatal checkup coverage decrease. First, the percentage of women who receive antenatal care from a skilled provider, including a doctor, nurse, or midwife for the most recent live birth decreased to 90.1% in 2025 from 94.3% in 2022. About 76.2% of women whose most recent live birth receive tetanus toxoid injections to protect their baby against neonatal tetanus. This indicates. Next, 7 in 10, or about 72.7%, women receive a postnatal check from a doctor, nurse, midwife, traditional birth attendant, or hilot within the first 2 days following a live birth. This dropped from 87.5% in 2022. Looking at the trends in antenatal care, or ANC, from 2022 and 2025, The proportion of women with a live birth who receive ANC from a skilled provider increased to 90.1% in 2025 from 94.3% in 2022. Meanwhile, the percentage of women with at least 4 ANC visits declined to 77.5% in 2025 from 81.4% in 2022. In terms of the percentage of women with coverage of 8 or more ANC visits, it rose from 21.4% in 2022 to 33.3% in 2025. Meanwhile, NIR ranked ninth lowest among regions, with 3 out of 10 women with a live birth, or 33.3%, had 8 or more ANC visits. The ANC coverage with 8 or more visits was highest in Central Visayas at 64.3% and lowest in BARM at 14%. On the trends in postnatal care for the mothers in NIR, the percentage of women who had a postnatal check during the first 2 days after a live birth decreased from 87.5% in 2022 to 72.7% in 2025. In NIR, 7 out of 10 women aged 15 to 49 years, or about 72.7%, who had a live birth in 2 years before the survey received a postnatal check within the first 2 days after birth. Comparing all other regions in the Philippines, NIR ranked fifth lowest percentage of women receiving postnatal care checks. Western Visayas recorded the highest at 91.4%, while BARM had the lowest at 54.1%. The 2025 NDHS also gathered data on skilled assistance during delivery among women, which tracks our progress in SDG 3.1.2, or the proportion of births attended by skilled health personnel. About 97.8% of live births were assisted by a skilled provider in 2025, an increase from 90.6% in 2022. Health facility-based deliveries demonstrated an increase since 2022. More recently, institutional deliveries in NIR increased to 97.5% in 2025 from 90.6% in 2022. We will now look at the results on domestic violence. The Philippines RA 9262, or the Anti-Violence Against Women and Their Children Act of 2004, was passed into law to address the issue of violence against women and all forms of abuse within the family and intimate relationship. In the screen, you can see this survey. Information was obtained from women aged 15 to 49 years in NIR who have ever had a husband or intimate partner and who have experienced emotional, physical, or sexual violence committed by their current or most recent husband or intimate partner. The term husband in this indicator includes a partner with whom a woman is living as if married. Husband or intimate partner refers to the current husband for currently married women, the most recent husband for divorced, separated, or widowed women, the current intimate partner for never married women who currently have an intimate partner, and the most recent intimate partner for never married women who do not currently have an intimate partner but had one in the past. In 2025, 12 out of the 100 women in NIR reported experiencing physical or sexual or emotional violence by their current or most recent husband or intimate partner. By region, NIR ranked third lowest in terms of experiencing physical or sexual or emotional violence by their current or most recent husband or intimate partner at 11.7%. Meanwhile, Caraga region recorded the highest at 24%, while BAR recorded the lowest percentage at 3.2%. Moreover, 10.9% of women in NIR ever experience emotional violence. 5% ever experience physical violence, and 1.5% ever experience sexual violence committed by their current or most recent husband or intimate partner. This slide shows the percentage of women aged 15 to 49 years who ever experience violence such as emotional, physical, sexual, and emotional or physical or sexual violence committed by the current or most recent husband or partner. In NIR, emotional violence decreased from 14.3% to 10.9%. Physical violence decreased from 7.8% to 5%. Sexual violence decreased from 2.4% to 1.5%. And any form of intimate partner violence, either emotional or physical or sexual, decreased from 17.5% in 2022 to 11.7% in 2025. That concludes the presentation on maternal health care and domestic violence. Thank you.
Thank you very much, Ma'am Elisha, for your comprehensive and meaningful presentation on maternal care and domestic violence. Indeed, your presentation raised awareness on important issues affecting women and families. At this juncture, ladies and gentlemen, for the presentation on fertility and family planning, let us welcome the Chief Statistical Specialist of the Statistical Operations and Coordination Division of PSA Negros Island Region, Ma'am Maria Gorete M. Novilla. Let's give her a big round of applause.
So, good morning, everyone. We will now present our recent findings from the 2025 NDHS on fertility and family planning. Pregnancy data were collected by asking women of reproductive age 15 to 49 years to provide complete history of all their live births, stillbirths, miscarriages, and pregnancy terminations. To ensure a comprehensive enumeration of births, women's responses to questions about their total number of children currently living with them, those living elsewhere, and those who had died were recorded, including pregnancies that did not result in a live birth. Family planning among couples will also be tackled in terms of the use and type of contraceptive methods to limit or space the number of children they have. This presentation consists of the following. First, we will discuss the total fertility rates and fertility preferences, followed by teenage pregnancy and family planning. The 2025 NDHS, this measures the average number of children a woman would have by the end of her childbearing years if she will bear children at current age-specific fertility rates. On the other hand, age-specific fertility rates, or ASFR, show the average number of live births per 1,000 women in a given age group. These rates are based on the detailed birth histories and are calculated for 3 years before the survey. Based on the result of the 2025 NDHS, the total fertility rate in Negros Island region is 1.4 children per woman for 3 years preceding the survey. Among regions, NIR is the second lowest in terms of TFR, tied with NCR at 1.4 children per woman. The lowest TFR was recorded in Calabarzon with 1.3 children per woman, and highest TFR was recorded in Barm with 2.4 children per woman. If the fertility were to remain constant at the current level, a woman would have a 1.4 children in her lifetime, and this is below the replacement level of 2.1 children. Now, let's move to the fertility preferences. Based on the 2025 NDHS result, more than half, or 56.7% of married women in NIR aged 15 to 49 years want no more children. About 12.5% would like to have another child soon. 12.3% of married women were undecided. In addition, 4.3% of women or their partners have been sterilized, 4.6% were declared infecund, and less than 1% want a child but are undecided when. Now, we look at the percentages of currently married women aged 15 to 49 years who want no more children or are sterilized. The number of living children shown on the screen also includes a woman's current pregnancy. Among currently married women with one child, the percentage who want no more children or are sterilized increased from 28.2 in 2022 to 36.4% in 2025. Among currently married women with two children, the percentage who want no more children or are sterilized decreased to 69.9% in 2025 from 71.1% in 2022. Likewise, among currently married women with 3 children, the desire to limit childbearing decreased from 88.9% in 2022 to 81.0% in 2025. In contrast, an increase was observed among currently married women with 4 children from 86.8% in 2022 to 90.1% in 2025. So this slide shows the percentage of women aged 15 to 19 years who are currently pregnant or have ever been pregnant. Of the 6.5% of women aged 15 to 19 years who have ever been pregnant, 6.5% had begun childbearing, wherein 3.8% are currently pregnant, 2.7% ever had a live birth, and on the other hand, less than 0.5% of women aged 15 to 19 years who have ever been pregnant result to pregnancy loss. As mentioned in the previous slide, 6 out of 100 women in NIR aged 15 to 19, or 6.5%, have ever been pregnant, making it to the top 5 highest region in terms of teenage pregnancy, tied with Caraga. Across regions, teenage pregnancy was highest in Zamboanga Peninsula at 9.3%, while National Capital Region recorded the lowest at 1.8%. Family planning among all women aged 15 to 49 years in Negros Island region, 33.4% use any method of contraception. While among those currently married women aged 15 to 49, 57.2% use any method of contraception. Now, let us look at the trends of the use of contraceptive methods by type among all women and among currently married women aged 15 to 49 years. Among all women, Age 15 to 49 years in 2025, 28.2% use any modern method of contraception, while 5.2% use any traditional method. On the other hand, among currently married women aged 15 to 49 years, in 2025, 48.2% use any modern method of contraception, while 9.0% use any traditional method. In terms of the use of modern contraceptive methods, pills reported the most commonly used in NIR at 16.0%, followed by injectables at 4.9%, at a stock on the demand for family planning among all women and among currently married women, a met need for family planning. When we say unmet need, it refers to women who, first, are not pregnant, are not postpartum amenorrheic, and are considered fecund, and want to postpone their next birth for 2 or more years or stop childbearing altogether, but are not using any contraceptive method. Also, have a mistimed or unwanted current pregnancy, or are postpartum amenorrheic, and their most recent birth in the last 2 years was mistimed and unwanted. In NIR, among all women aged percent in 2022 to 8.6% in 2025, while the met need for contraception slightly decreased to 33.4% in 2025 from 35.3% in 2022. Among the currently married women, the met need slightly decreased to 57.2% in 2025 from 58.4% in 2022. And in 2025, the currently married women aged 15 to 49 years is 70.9%. That concludes my presentation on fertility and family planning. Thank you very much.
Thank you very much, Ma'am Margot, for sharing the important findings of the survey on fertility and family planning. Your presentation provided us with valuable insights and a deeper understanding of the current trends and concerns that are vital in formulating responsive programs and policies for families and communities. Before we proceed to the next segment, let us watch this audiovisual presentation featuring the key findings of the 2025 NDHS. Please direct your eyes on the screen.
The Philippine Statistics Authority, with technical assistance provided by the United Nations Population Fund Philippines through the Australian Department of Foreign Affairs and Trade, present the 2025 National Demographic and Health Survey Key Indicators. The percentage of women aged 15 to 49 years decreases with increasing age group. About 19 in every 100 women, or 19.2%, belong to the youngest age group of 15 to 19 years. About 11 in every 100 women, or 11.3%, belong to the oldest age. More than half of women, or 57.5%, are from urban areas, while around 4 out of 10 women, or 42.5%, reside in rural areas. By region, the National Capital Region accounts for the largest share of women with 15.0%, followed by Calabarzon with 13.5%, and Central Luzon with 12.1% Catholic, 12.6% are Protestant, and 5.6% are Muslim. Regarding ethnicity, Tagalog is the predominant ethnic group among women at 29.6%, followed by Cebuano at 16.8% and Ilocano at 9.3%. In terms of education, about 2 in 5 women, or 40.8%, have completed some college. Nearly half, or 49.5%, have completed some junior or senior high school. Meanwhile, 7.5% completed some primary school and less than 1% have never attended school. By marital status, the majority of women, or 54.2%, are currently married or living with a partner as if married. 42.7% have never been married, and a